So welcome everyone to our community meeting. I know the spirit has been very difficult for everyone. It's awful that we can't be together right now, but thank you for attending our groups throughout the last several weeks and showing up to our community meeting. Tonight, Isabel and I are going to be talking to you about some of the resources and different websites, different tools and strategies we've been using, the BIST staff, not just Isabel and I, but the BIST staff, to keep busy. I mean, it's a difficult time for everyone, sure, and I know as we've been talking in the groups, everyone seems to have something that's keeping them busy, but I mean, with so much time indoors and away from everyone, you start to run out of things to do. So these are some of the things that we've been doing to keep busy, and I am going to start sharing that now.
Google Earth. Oh.
Okay. Can everyone just let me know that they see the slides right now? You can just type in the chat if you can.
I'm seeing the slide. Yeah, okay.
Okay.
Showing Hillary, yes, yes. I'm getting lots of yeses down here.
Perfect.
Thumbs up,
okay.
Thumbs up. I got a thumbs up.
Wonderful.
And an exclamation mark.
Okay. So
we're good.
I believe I was taking a quick look in at our participant list, but if you don't know me, I am our new programs and peer support coordinator. My name's Ryan. I've been with BIST for the last couple of years, and joining me in this presentation is Isabel Rivoletto. She is our violence impact coordinator. I believe that's your title. Yeah,
that's correct. Yeah, that's right.
So let's get started. We do have a bit of an agenda with our tall, faceless man here with a gorgeous yellow tie. So we're going to start by talking about, again, some of these resources that we've been using to keep busy and keep entertained. There's a few demonstrations that we're going to be, showing you. Mostly, there's some videos, and then Isabel and I are going to demonstrate an app or two. And then we're going to move into talking about some more COVID-specific information and talking about the CERB benefits, and then we'll wrap up with some Q&A. But it's kind of hard to avoid a webinar or any information session these days without talking about COVID. So if you do have questions, please save them for the end if they're concerning COVID. But we do have some cool stuff to share, so stick around. I mean, how do you begin a webinar or a talk about things to do on the internet without talking about YouTube? I mean, it's probably the first thing I did as soon as I realized I wasn't allowed back in the office. I don't know about you, Isabel.
Yeah, I've started to kind of do anything on YouTube, look up any kind of music lessons like that, like movies, weird information, like just weird facts, fun facts about things. Yeah, YouTube is a great place to go for everything.
Yeah, it's probably where I was getting my news for the first couple of weeks, and then
for sure.
I think like many people, I grew averse to watching the news. It's been hard to watch the news. I know it's still out there, and it's important to be informed, but maybe we can do that for you. And so what we did want to do is kind of just sample all the different things you can find on YouTube. This is obviously not a list of everything that is out there, but these are some good examples of what you can find on YouTube. So for one, if you are musically inclined and you happen to have a guitar with you, and I know a couple of our members do, there are some fantastic resources on YouTube for getting guitar lessons, lots of lessons, like months worth of it. And one resource that we did find, and one I've watched a few times, I think I've tried to learn guitar and failed a few times, but it was always with this guy, Justin Guitar, and that's nothing against him. I think it's me take on too many projects, but he is a wonderful teacher. And the fact that we put the guitar lessons in here, it's not that you should or need to go and watch these lessons. There's lots of other different guitar lessons if you want to just find a song and learn how to play that. Like everything, I am certain it is on YouTube.
I learned how to play drums on YouTube, so
Yeah, it's on there. So, you know, if you were interested in keyboard or piano, I'm sure there are lessons there as well.
For sure.
When it comes to meditation, I don't know. There's been a lot of our members have been asking about different meditation resources, different webinars that they would like to see, but a lot of people have been asking me in particular, but also our info line, which we'll talk about a little bit later, about whether or not there are some meditation resources. I happen to know of several, and we're going to be sharing them throughout the presentation, but one of them that I really like, and that started exactly as COVID got started, was by John Vervaeke, who is a University of Toronto professor, and he is putting on a series that will not end until COVID ends, whenever that is, but whenever we're all sort of released back into the city, is when he'll stop. He's committed to doing a daily meditation on his channel. So at 9:30 every day, he does a live meditation. It's guided. He provides some instruction. And then he has a question and answer period, which is really invaluable when it comes to meditation. You know, I've talked about this in groups in the past week or two, and, you know, I think it's true no matter what group you're in. But when it comes to meditation, unless you're practicing and you have someone to ask questions to, you kind of try it for a while and maybe it helps, and then you just let it go. You know, other stuff gets in the way. So having a really knowledgeable person to not only inform you, but guide you through meditation, and then have the opportunity to ask him questions every day, Monday to Friday. It's a fantastic resource. It's one I've been using. I've been using it since he started, and I think he's maybe like 20 some odd days in, or maybe more at this point. But we'll share some more meditation resources later. When it comes to yoga, there, again, just loads of stuff on YouTube. One that I thought was very good, especially for our community, because people have different limitations, physical and otherwise. So there's a 30-day intro to yoga offered by Adrienne. And again, this series, it doesn't cater to all of those needs, but on her channel, you will find something for you. I promise. There's lots on there. If you're, you know, feeling motivated to learn something new while isolated, you know, languages are something that a lot of people are turning to. And Lingo Steve is someone who can not only teach you specific languages, but he also gives you sort of the building blocks. You know, it takes something more than just focusing on a language to learn a language. There's different strategies, different tips, and he provides you with those. He's a very knowledgeable guy, and, well, you can find out more about him if you visit his YouTube channel. And at last, I mean, the books, audiobooks, if you need a solid 6-hour long break from thinking thoughts or not being around people, an audiobook is a great way to keep yourself, one, entertained, and, you know, read, or not read, but, you know, hear some great information, some great books. And this YouTube channel, Great Books, really, it's not any of the sort of like new nonfiction or new fiction. It's some of the old literature that's stuck around for decades at this point, but still really entertaining nonetheless. Next, we come to phone apps, and again, we could have done a massive list here, but we wanted to make them, or this list, about the ones that we've been using. Isabel and I are going to demonstrate the House Party app in a minute or two, so I'm going to save that. But again, we come back to meditation. There's lots of different apps on your phones, whether you're an Android person or an Apple person. You're going to find these apps in your store. These ones are free, the Insight Timer and the UCLA meditation app. They're both very good. You do need to be a little bit cautious with the Insight Timer. They do have some built-in features where they're going to ask you to pay for something. You don't have to, you shouldn't. There's lots on there for you to use without having to pay for it. But if you are looking for something a little bit more, the Waking Up app is something I've been using for the last 1.5 years, 2 years now. It is a pay paid structure app. You do have to pay for it, but during this period, the creator, his name is Sam Harris, he is allowing people who want access to it to have it for free. The reason I put an asterisk next to it is not only because you have to pay for it, but in order to get it for free, you have to send his support team a letter. If that's something you're interested in, I'm going to ask that you, if you want help, you email me, and I can tell you what steps to take in order to send that email and who to send it to. Or I can just provide you with the information. I can also help you write the letter if that's what you're interested in. And I'll, again, provide my email, Isabel's email, our contact information at the end of the presentation. Another fun thing to do on your phone is podcasts. Lots of podcasts out there. And like YouTube, I mean, really something for everyone. What you choose to watch your podcast on or listen to your podcast rather, it really doesn't matter. I think at this point, all the content is more or less shared across the different platforms. But, you know, if you're an Android person like I am, Castbox is what I've been using. It's very user-friendly, very easy to sort of navigate and find different categories, different things you might be interested in. Stitcher as well. I think that's on Apple and Android, and then of course Apple Podcasts. And we're going to talk a little bit more about specific podcasts in a second, but let's see what House Party is all about.
Okay, so I'm gonna give this a shot.
So I'm going to stop sharing, Isabel, and just hang with us there, everyone. So this is the House Party app, and Isabel's going to tell you a little bit more about what it is, but it's wonderful.
So this is our house. Ryan and I both have our own houses, and any of your contacts will have their own houses. It's kind of designed like kind of a 1990s house party in a sense that you can go into people's houses, which I'm going to actually do now as I'm going to join Ryan's house. So we're in the same house now.
Hey.
There's a little icon on the top of the screen that has dice. So this is how you can play online games with your friends on video. You can do, yeah, I know, it's like you're like looking at yourself. It's so weird. So you can do this. You can have up to 8 people in your house. So a lot of friends can join in together, peers. Also, if you look at the bottom of our screen, there's a little tiny icon that looks like a padlock. If you only want to speak to specific people who are currently in your house, you can lock your house, which I'm going to do. Now it says you've locked the room. So Ryan and I will be in this room alone. Nobody else will be able to join. If you do not lock the room, any one of your contacts on your contact list or your friend's contact list who you are in the house with can join your house. So it is a great way to meet new friends. It's a great way to reconnect with old friends. Right now we are super isolated. There's like, we're running out of things to do. So if you are interested in meeting new people, it is a great way to meet friends of friends, and it's a great way for friends to meet your friends. So I'm gonna pick a game now. So you can pick all kinds of different ones. We're gonna do a trivia game. We'll do pop culture, and let's play. So let's do it. All right. The actor who played Freddie Mercury in Bohemian Rhapsody also starred in what show?
Yeah.
Yeah.
Great show. Love this show.
What monster was the main subject of a 1974 Mel Brooks film? I honestly don't even know this. I'm just guessing.
I have no clue. Yeah, let's take it.
All right. Maybe we'll do one more round and then we'll quit it. What's the first film in which Robin Williams played a traditionally dramatic role?
Great movie. Love Dead Poets Society.
So this will continue going rounds and rounds. I don't know how to switch games yet without leaving the house and coming back in. So I'm just gonna hit the little X and see what happens. And it gave me a little like, yeah, fun fact. So that is the House Party app. We're back out to the main screen now. These are all like, you can see your friends. You can invite people from your contact list. So that's how you do that. So if anyone's interested in doing that, it's a free app. I have an iPhone, as you can see. So I use my Apple Store, my App Store. So if that's something you're interested in or you need help, you could definitely contact us and we'll help you figure out how to obtain that for yourself. So you can be a little bit more connected than we are right now, which is a little
Yeah,
bit,
exactly.
yeah.
Okay, let's get back into this presentation.
Also, I'm very sorry, everybody, if I talk fast. So just like chat me to slow down. I'm a fast talker. Just so you know.
So again, we said we'd talk a little bit more about podcasts. Really, there are so many. I think I could probably put together a list 3 or 4 times this long, including these ones. But these are some really entertaining ones, some really fun ones. And Isabel, maybe you want to tell us a little bit.
I will. So the first one I'm going to talk about is called My Dad Wrote a Porno. The name is a little bit deceiving. It's actually about this British man who found a book that his father wrote. His father actually did write a porno, and he has 2 friends that he does readings of this book. And the father is an old school British man who has very dry humor and not a very good sense of the female anatomy. So it's pretty riddled with just insanity. The cool thing about My Dad Wrote a Porno also is that the 3 of them do readings. I believe they had an HBO comedy special. So they did readings where they traveled and they would do shows and read to people and they discuss the book between the 3 of them. So it is actually really funny. Like I have listened to a couple of episodes and I've like side split left until I cried basically with that one. So if you're really bored and you're kind of sad because you can't go anywhere, this is a really good way to spend some time. And if you're lucky enough, you might be able to even go back to YouTube and find an HBO channel. You can probably find readings of it on YouTube. So if you're finding the podcast hard to follow, I have a hard time following podcasts sometimes because there's no visual to go with it. But this one you can actually go on and see the show. You can see them do the show and do the readings, which is really cool. So if you're kind of bored and you want something different, I would definitely suggest looking it up. How Did This Get Made is kind of the same thing. It's comedy, but it's about movies. So they basically pick apart like old Hollywood movies and explain how they were made and why they were made. And they have these little like fun facts about them. And the Teacher's Lounge is the same thing. It's just a whole bunch of basically friends kind of sitting around discussing weird, funny things. I don't know that the other 2 have actual HBO specials or anything that you can visually see, but I definitely know that My Dad Wrote a Porno. You can look it up online. You can probably find the readings. It is really, really funny. So I highly recommend it if you're like into, things that are funny.
Yeah, awesome. Again, we're talking about different ways to get your news, while YouTube has, lots. I prefer not to watch the screens anymore when I'm taking in my news. It just seems like it's too much. I'd rather listen to news for about 20-30 minutes while I'm doing something else so that it doesn't feel so awful the whole time. Maybe you feel differently. But the way I've been taking in my news is listening to the New York Times podcast called The Daily. It's great that they do an episode every day, of course, and really you get condensed news delivered in like 20 minutes. So listen to the news. It's all very credible stuff through the New York Times, of course. But maybe just a different way to take in the news. I think being in front of the screen and taking it all in all the time it's not the healthiest thing. It doesn't feel so great. So when especially right now when it's all a little bit tragic. So just another way to take in the news. The other one that I've been listening to a lot, because it really, there seems to be so much confusion out right now about the coronavirus. What's fact and what's fiction. So CNN and I think their lead correspondent, Dr. Sanjay Gupta, he has put on a podcast about the coronavirus where for 20 minutes, and I forget how many episodes he has now, probably upwards of 30 or so. He talks to you about different aspects or different myths about the coronavirus, and he just pulls them apart. So, if you are feeling overwhelmed or you're feeling like you're uninformed about something or potentially misinformed, this might be a good way to go about getting some good information. And again, you can listen to it while you're doing something else. Of course, you know, again, through podcasts, you can listen to any number of audiobooks. Loyal Books, I know, is available through the Android store. I think Apple has their own audiobook sort of app.
I think so,
But again,
yeah.
lots of free stuff right now. There's loads of stuff to keep you busy. And of course, languages as well. I think Duolingo is one that a lot of people have been using. A few of my family members, they use that podcast, so you can just go and listen to people speaking whichever language you're interested in. And you know, that's a legitimate way about going to learn a language. I'm going to stop sharing for a second because I want to pull up a website I'm sure many of you are familiar with. Toronto Public Library. There is so much available for free as long as you have your library card. It is wild that you know, we constantly look for ways to sort of like spend our money on entertaining ourselves, but the library is going to offer you a lot of free stuff and a lot of relevant new stuff. But having talked to some of our members over the last few weeks, it doesn't seem that everybody knows exactly how to use their website and how to access this information. So here it is. This is the front page of the Toronto Public Library website. And right here, eBooks and online content. We can open up either of these. Again, you can see that there's digital video and music, magazines, newspapers, comics, if you're interested in that. The other one I wanted to click on is eLearning. So let's start there. There are a number of courses you can take through the library right now. So, I mean, to learn something while you're physically distancing, socially isolated, however you want to call it, is a great way to spend your time. Learn something you're interested in. I mean, take advantage of this time in any way you can, but this is one way to do it. And again, all for free. The library doesn't do such a great job about telling you exactly how to use the different courses or how to look for more courses. So you'll see here, you can click on more courses, but it's not organized very well. What I have found, so this is a bit of a tip, is if you go to where it's provided through, so lynda.com or Gale courses, there should be one more somewhere else. I think Sage videos, something like that. But they have much better search engines, and your library card is already connected to their database. So it will filter what is available to you and what's not, and it makes it a lot easier for you to search through what's available to you for courses. I highly recommend lynda.com. There's lots of interesting stuff on there. Same thing with audiobooks. This is how I've been getting all my audiobooks. I know we talked about how you can get them through podcasts, but I find it's very easy to use the library's system. So this is what it looks like. It was as easy as clicking those couple buttons. And you will find that there's lots of different collections in here. Fiction, nonfiction, again, more audiobooks. And eBooks as well. So I know the libraries are closed right now, but if you are looking for something to read, I mean, it really is still online. And you would get that through this right here, eBook services. If you are having trouble using the library website and you want some more help with it, again, please feel free to reach out to me or our info line, and we will help you out. Just gonna get us back in the presentation. Okay. This is, you know, there's obviously lots of websites that we've been visiting, but not all of them are so interesting. I mean, there's very few websites I visit outside of YouTube, for example, or the library to go and keep busy. I really don't find that the internet, as wide as it is, all that interesting. So the couple websites I have been using to just keep myself entertained is the Duolingo website, which is such a fantastic platform for learning language. They make it so entertaining and engaging on their site, and you can see your progress as you're moving along. That they really have it very well structured, and very much designed for beginners. So if you're new to wanting to learn a language, or you just want to see what it's about, they do kind of make it like a game. So there's some quizzes in there that they really challenge you, but they make it pretty fun. The other one I really like is Sporkle. And if you've attended one of our groups in the past, you may have played a Sporkle quiz with me. I'm going to quickly show you what they look like, because I might be tempted to play more than one. So this is the Sporkle website. What I like to do, because there are hundreds of thousands of quizzes on here, but probably upwards of that. But I like to come to either categories or quizzes, and then the popular one, the popular drop down right here. And these are the ones people have been playing for years now, and they're rated, but this is a bit of a mixed bag. But I was playing one earlier, you can test your knowledge on fast food logos. So here they all are. You would start the quiz, and you're timed. So you've got 5 minutes to answer all of these. And I know that might not sound super entertaining, but I promise you there's something on here for everyone. If your thing is music or television or movies, geography, sports, I know we've got a lot of sports fans, entertainment, religion, there's a quiz on here for you, and not just one, probably hundreds. And I've spent hours on here just losing my mind at trying to answer all of the questions in 5 minutes or 10 minutes. So just another fun little resource. And one of the last demonstrations I want to show everyone is Google Earth. Google Earth might not seem all that interesting. I'm sure you've been on Google Earth to, I don't know, look up directions or whatever. Maybe you want to go and visit something on Google Earth. They're offering a lot right now, a lot of really entertaining stuff. And I want to show you a couple of the things that I've been doing. Let's go to Google Earth. Isabel, can you give me a thumbs up? You see Google Earth right now? Yeah.
I see Google Earth. I see the Earth. Yeah.
So here it is. This is what you would find on Google Earth. If you come to this little ship wheel, it says Voyager. Click on that, and across the top here, there's different things you can do. So you can learn some more about nature, traveling, education, but there's some games. Probably not what you're expecting on Google Earth, but they are a riot. They are so fun.
This was actually new to me, so.
Yeah. So there's different quizzes on here. There's a rock and roll icon one, ancient civilizations, and what it's going to do is bring you all over the globe and walk you through some of these different sites. One that I've been doing a lot, because it just reminds me of childhood. I don't know if everyone remembers Carmen Sandiego. Maybe this is very childish, but it's a lot of fun. It's going to take you on a bit of an adventure. So it's a game, but it's going to use Google Earth to bring you to different places and ask you to answer different questions. So we can begin the chase and see what this looks like. I'm going to scroll through some of these very quickly just so I can show you what the actual game looks like, but there's a bit of a narrative here, a bit of a story to it. So obviously it's a game, they want to make it fun. But you get through this, and we're trying to find Carmen Sandiego. So we're going to be looking for different clues We're going to be moving around London to different sites and talking to different people to get these clues. So you can see in the green box here, it's giving you some information about how to use these different features. So if we went to Buckingham Palace, I've never been except through Google Earth here, but it looks pretty cool.
Mm-hmm.
And one of the guards is going to give you some information, your next clue. So she's changed her money to yen. You can always come back to the magnifying glass and get more clues, but if you see the next place you can travel to, if she was changing her money to yen, she's probably heading to Tokyo. So the game would continue on and on like this, and really it goes on for quite a while. But just a really fun way to explore different places, different popular places around the globe, and do it in sort of a really entertaining way. So something that's going to keep you busy for a while rather than just bore your pants off for 5 minutes and then you're going to look for the next thing to do. And there's 3 of these out, so. Okay. So on to the COVID part of our presentation. There really is a lot to share here. We're going to spend probably about a half hour talking about different stuff and showing you some videos. If you do have questions, I'm going to be looking at the chat. Isabel's going to be looking at the chat. Like all of our community meetings, this is meant to be a time for you to ask questions if you have them, or just to tell us about something that you would like to see on this COVID research page. But before we do, I'm going to ask everyone to join a Kahoot. So this is a quiz that we're going to be doing. It's an interactive quiz. And what I'd like everyone to do is either on their phone, either on your phone or on your computer, go to this website bolded, www.kahoot.it. And when you get there, you're going to put in this code. So I'm going to be quiet for a couple minutes. I'm going to let people join. Sorry, 1 sec. Didn't mean to do that. Once you have joined, please let me know in the chat that you've gone to the website and you've put in the code, and then I'll be able to start the game. Hillary's in, awesome.
All right.
So just hang out, Hillary. We'll get it started soon. Shireen is in, awesome. So while people are getting onto the website, I'm just going to tell you a little bit more about it. This is going to be sort of an anonymous quiz. You're going to have a random name assigned to you. There's no pressure. We're just going to ask some questions, mostly about different myths about COVID, a lot about the misinformation that's been circulating. And then we're going to talk about some good information. But really what we want to do is just get an idea of, what our community thinks is true right now. Because, in researching these questions, I learned a lot. Stuff I thought I knew wasn't accurate. So a couple more minutes. Roseanne is in, awesome. So I'm going to stop sharing this screen for a second. If you still need the code, put it in the chat and I'll get it to you. I just need to switch the screens. Okay, looks like there's a few people in, so I am going to start it. If you're using your computer, I'm just going to warn you ahead of time. You need to watch the Zoom presentation in order to see the question. So you probably have the Zoom in maybe one tab, and then the Kahoot quiz in another tab. You'll see the question in the Zoom tab, and you'll have to switch back to the Kahoot tab to answer. They're all true and false questions, so you're going to see, I think it's a red block and a blue block or something like that.
Red block is for false, I believe, and the blue block is for true. So if you think the question is true, click on the blue block, and if you think it's false, click on the red block.
Yeah, yeah. But again, if you're on your computer, you'll have to switch back and forth. If you're doing it from your phone, just keep watching the screen.
If it's helpful, I can read the questions.
Yeah, if you don't mind. Okay,
yep.
One more person got in. I might give it just one more minute. See if anybody else is interested in joining.
So I'll read the questions out loud and then answers picked.
Okay, 5 players. That works.
Right.
Let's start this thing. 6 players.
Woo!
Right on. Maybe one more minute. You know, we got 2 more people. I want to give everybody a chance. Again, it's anonymous. You can see there's very strange names up here. I know you know none of this really counts for anything, but it is good to just sort of get an idea of what everybody thinks right now. So let's see. Let's start this.
Warm weather will kill the coronavirus.
So true or false? So there's about 6 seconds left for answers. Okay, so the correct answer was false. I know 3 people voted true, but we'll share a resource at the end through the WHO. Warm weather will not kill the coronavirus. I know there was some information when all this got started that, you know, perhaps throughout the summer we might see cases really drop off, but this is already a very big problem in some of the warmer climate countries and continents. So this isn't something we're going to see get fixed throughout the summer just as a function of weather. It really does mean that we need to keep up the things we've been doing, and we'll talk a little bit more about that as well. Let's get to the next question. There's our scoreboard. Okay, Nimble Elephant, well done, well done. So exposing yourself to the sun or temperatures higher than 25 degrees Celsius will prevent COVID. Yes. So if you answered false, you're correct.
Yes.
Again, the temperature is not what's going to fix this. And we'll talk about that a little bit later. But good for you for answering correctly. New leader.
Friendly hair.
Well done, well done. Okay, next question.
If you can hold your breath for 10 seconds, you do not have COVID. If you can hold your breath for 10 seconds, you do not have COVID-19. True or false?
Yes. If you can hold your breath for 10 seconds, good on you. But that does not mean you do not have COVID-19. There are lots of different home tests you can do. One of the early ones was holding your breath for 10 seconds. We've seen other ones since, but you really do need to go and get tested if you have symptoms. So hold your breath if you want, but maybe do it when somebody has a swab in your nose.
Friendly hair's on fire.
Wow, 3 in a row. Okay, this is the last question. So, true or false, spraying alcohol or chlorine all over your body will kill the new coronavirus? Right on.
That's right, guys.
Looks like everybody knows that will not do anything. And I'm sure if you've been watching the news over the last week or so, I think the last 3 or 4 days, you may have seen the President of the United States suggesting that ingesting some sort of disinfectant or bleach or what have you will do something. It will not. It will
kill you.
Make you very sick or kill you. So applying it to your skin or ingesting it, injecting it, however he phrased it, it's not going to help us out. There is no vaccine right now. The best measures we have are the ones we're taking. Physically distancing and washing our hands, not touching our face. But we will talk a little bit more about that right now. Thank you, everyone, for participating. I know that was a bit of a silly quiz, but again, it's really useful for us to, see what we do think, because being challenged with some of our thoughts isn't always a bad thing. We want to get the right information.
Mm-hmm.
And to get some more of the right information, Isabel is going to tell us a little bit about the CERB.
So, as most of you probably know, the federal government has instituted the CERB benefit for individuals who are employed and who are suffering loss of employment due to COVID. So to qualify for the CERB benefit, you have to have earned a minimum of $5,000 of income within the last 12 months or 2019 from one or more of the following sources: employment income, which means you have had a job in which you've earned 5,000 or more; self-employment, which means you owned your own business in which you earned 5,000 or more, or you were on some kind of maternal or parental leave during 2019 and or during COVID. If you are on any kind of assistance, OW, ODSP, CPP, CPPD, LTD, or insurance benefits from a car accident, you do not qualify. If you apply and are found to be ineligible at tax time next year, you're going to have to repay the entire benefit. So the chunks of CERB money are coming in at $2,000 every deposit. I believe that right now they're running for a 16-week span of time for people who have lost income or don't have their jobs any longer. So the reason that people who are on assistance are not included in this for this benefit is because people on assistance, their incomes have not changed. If you were getting $1,200 a month from ODSP prior to COVID, you're still getting $1,200 a month from ODSP during COVID. This is for people who were, earning a lot more, like maybe $2,000 or $3,000 a month, and now they're only earning either under 1,000 or much, half their income or nothing at all, because they've actually lost their jobs when this entire crisis sort of started. So if you do apply, you're probably going to get the benefit, but they're going to come and have you pay it back next year at tax time. So it's really not a good idea. However, on the flip side, if you're on ODSP and you have a part-time job and you have lost some income due to COVID, then you could apply for the benefit and you likely will qualify for some portion of it. So, but if your income is specifically social assistance or LTD or CPP, CPPD, you're going to have to pay back the whole thing. I have heard through reading different articles that for this one thing, the government will not be asking for any kind of interest. There was a rumor floating around that there was going to be a 25% interest penalty for people who applied and were not eligible. But from what I've heard, and I hope this is what they stick with in the end, that you're just going to have to pay back the amount that they've given you. So if you end up getting $2,000, you'll owe back $2,000 next year. I have heard people question and say they wanted to apply for it anyways, and that they would deal with the consequences next year at tax time. and that they would like to just take $50 off their check or whatever and have it go to the government to repay the benefit, and that they would rather have the money up front right now. But the problem with that is the government may not allow you to choose the denomination that's coming off of your check come next year. So after doing some budgeting, you may decide that $50 a month is okay for you. You don't mind paying $50 a month to pay back the $2,000 or however much you were able to get. But the government might say no. They might say we want $250 off of your check or $100 off of your check, and they're going to scale back pretty well however they decide is going to be fit for that time period. So in order to stay safe, I think the best bet is to just avoid the CERB benefit for now. Something may come out. I have heard rumors that there may be some kind of assistance for people who are on assistance. Right now, that's not the case. So unless you want to owe back a huge chunk of cash next year at tax time, I feel very awful because I believe that people on assistance don't make enough money per month anyways. So, I mean, $2,000 a month should be going to pretty well everybody at this point, like all the time, but all the time. Not just because we're in the middle of a global pandemic. We should all be getting some kind of basic income, which is upwards to about, $2,000 a month is what people could probably comfortably live off of if that's what they were getting from their assistance. However, we are not, and unfortunately, applying for this benefit and receiving this benefit could really end up costing you in the long term. And it's going to be really hard for folks like us to help you apply for relief or forgiveness. I feel like right now they're going to be really lenient, and they're going to try to help as many people as they possibly can. But I think when they've scaled back next year and they're trying to figure out all the people's eligibility criteria, they're going to really be clawing for their money back. So it's really a decision everyone is going to have to make at some point. Yep, it's great to have $2,000 dumped into your bank account right now, but are the consequences in the long term really worth it? I don't know. I mean, yes, we all have the right to explore it. We definitely, please ask us questions if you have any questions, concerns. I'm on everyone's team here. I think everybody, regardless of what their income is, should be getting at least, a minimum basic income at some point. That's way more than what you guys are getting, but I'm not sure at this point that the benefit is going to outweigh the risk or the consequence that's going to happen when this is all over. So if you have any questions, or if you want to explore any kind of benefit that you could possibly be eligible for, please feel free to email me or give me a call or text. My information will be at the end of the presentation, or I can just put it in the chat right now so you guys can write it down if you'd like, or copy it. I'd be happy to explore any other kind of monetary compensation you can maybe possibly get, or any kind of resources if you need help with like groceries or just regular day-to-day supplies. But if you are on assistance, unfortunately, the CERB benefit at this point is not for you. So we just wanted to make that clear because a lot of people are asking me, and I think a lot of us, specific questions about CERB, because it does look like, it really looks like a Mandarin buffet when you have a very empty bank account. And unfortunately, even people who work full-time are still thankful that they're working, but we're all struggling a little bit right now. So let's just struggle a little bit together, and let's help each other through it. And if you have any questions, please feel free to contact me.
Yeah, thank you, Isabel. Oh, that was a wonderful description. I actually want to, before we move on, one of our members shared a comment and has asked a question. I just want to maybe read the comment out first, and then maybe you can answer the question if that's okay.
Sure.
So her comment was that the government's logic is faulty because our expenses are up. Example, water for increased hand washing, heating for increased hand washing, and laundry. Delivery costs for food as well. We need universal basic income. I think Isabel
we do.
echoes. Yeah, absolutely. We do need to see, everyone on social assistance receive a much higher standard income. It's really not livable at this point, but that is a fantastic comment. We absolutely agree with you.
Absolutely. I mean, sorry, I'd hate to cut you off, but I mean, the reality is that like some of the people that have lost their income or their jobs during COVID are paying mortgages that are $3,000 a month and up. So their $2,000 a month that they're getting from CERB is not helping them really at all. So I think everybody's in a different income bracket. everybody's struggling right now. It's not the same struggle. Everybody has a different struggle, but I don't really want to put anybody's struggle above another person's at this point, because we're kind of all in this together and we all have to battle through this together. So if us being here and present together and asking each other questions and asking each other for help is going to help us all get through this, then amazing. Let's do that. Let's not, be angry or, judge people who maybe still have their jobs or have had great jobs their whole lives and have just lost their jobs. Unfortunately, when we make more money, we sometimes live at a little bit, outside of our means, and some of these folks are really struggling pretty badly right now. So I think we just need to all be there. It's a human response right now, and this is a human existence and the experience. So let's all just experience it together and do the best we can with each other.
And I just want to quickly follow up, because she did ask a great question as well. So the question is, under CPP disability, you're allowed to earn just over $5,000. So would you be allowed to apply if at or just over $5,000?
You have to have earned a minimum of $5,000. So, I mean, the thing is, yeah, it's within your right to apply. What they're going to do about that next year is up to them, though. They may go through people's applications and no, because also the minimum of $5,000 has to be earned through employment income. It has to be earned through self-employment income, or it has to be earned through federal benefits of parental or maternity leave. So the CPP earning $5,000 a year is not considered income that's eligible for the CERB benefit. And I think that's a really good question, because I think that's where a lot of people are getting confused, because they're like, I earned the minimum of $5,000, but it's not from a source that is eligible for the benefit. But like I said, it is your right to explore and apply, but the consequences that may occur after it may not be worth it.
Yeah, awesome. Okay, we're gonna move on to the next slide here, and if I can get my computer to cooperate. Here we go. So again, we sort of did that quiz in the beginning to see where everybody's knowledge is at with regard to COVID. And thank you, Isabel, for telling us a little bit more about CRB.
No problem.
But again, these social distancing tips, the hand washing, these are really what are going to keep us safe right now. And even these strategies, these skills, these tips, there's been misinformation about these as well. So we have a few YouTube videos here that I'd like to watch together. We won't watch all of them. I'll quickly give you a quick description of what we're going to be watching, but we will watch most of these. So the first one is a hand washing tutorial. It blows my mind that I've never seen this before. I will tell you right now, I was not washing my hands correctly. I wasn't washing my hands long enough, and there were parts of my hands that I promise you never had soap touch them. None of us are innocent in this. It seems like a really simple thing. I put some soap in my hands, I scrub them together for 10-15 seconds with some hot soapy water. We're good, COVID free. No, there really is a bit of a technique to this, and you're going to see in this hand washing tutorial just how easy it is to miss some spots if you're being quick and not taking the recommendations a little bit more seriously. So we'll watch that one first. We'll then watch a short video by Vox about how soap kills the coronavirus. And I think this video is really important because they do a great job explaining why just washing your hands is going to have a big impact on this. If only washing your hands was one of the strategies you took from tonight, you'll be far better off throughout this period, however long it is, and you'll understand why after we watch the video. It really does kill the coronavirus if you do these things correctly.
Can I just say something before you're done talking?
Yeah, of course.
One thing that has been driving me personally crazy, and I know we're kind of in a forum now where we can discuss these things, is the false senses of security that we're getting from certain things, like wearing masks. The masks are not designed to protect you. The masks are designed to protect other people from you. So there's that. So that's definitely some food for thought. And gloves. gloves are great when you're working in an ER or you're in trauma or whatever the situation is. People who are lay people who don't work in medicine do not know how to put gloves on properly and take gloves off properly. The gloves are leading you into a false sense of security because people who are wearing gloves and handling them improperly are going into grocery stores and they're touching all the food and they're touching one thing and putting it back on the shelf. Then they're picking something else up and putting it back on the shelf. And they're doing this repeatedly, and then they're touching their phones, and then they're touching their faces, and then they're touching the carts, and they're touching the money and everything else. And then we have a coronavirus community contaminations, and this is where people are getting sick, right? So if anything, if you're listening to anything that Ryan is telling you right now, and I'm telling you right now, please, please, please watch this video, learn how to wash your hands properly. Washing your hands properly and physically distancing and following the rules in the grocery store and the arrows and the lines you have to be standing on are the best things you can do for yourself. More important than having gloves, more important than wearing masks. So that's my TED Talk. Onto the video.
Yeah, let's watch these. They're very short videos, but we're gonna get through 3 of them. I think they're all about like 3 minutes each. But let's start with how to wash your hands properly. So what you're going to be seeing in this is someone is wearing a pair of gloves. They've put some ink in their hands to represent soap, and you're going to see how moving it around your hands is not as straightforward as it looks. You really do have to be very careful, a little bit diligent about really getting in all of the nooks and crannies, and this is what it looks like.
I feel like this is the most important part of the hand washing. It's that part at the end there, and this, yeah.
Yes, big thumbs up, whoever put this video together, thank you. So, I mean, I'm guilty of it again, doing this. Some soapy hot water for 10, 15 seconds after you've used the washroom or after you've done something. It's really not cutting it. If you can imagine that you had the coronavirus on your hand somehow, or contaminated, if it was up on your wrist, you would easily have missed it. So in addition to that, it's really important to follow up with this next video about how soap is killing the coronavirus. So I'm just gonna give everybody a warning here. I was having some issues with volume earlier. I plan to play the video for about 10 seconds or so. If you could let me know in the chat if you hear the audio, that'd be wonderful. The subtitles are turned on, so you'll be able to read what they're saying. We are obviously gonna put this on YouTube afterward, and I'll be sharing the slides so you can find the links afterward. Don't worry if you can't hear it right now. Taking in what you see and what you can read is just as important, but let's see if this works.
You know that the best way to prevent the spread of coronavirus is to wash your hands. Wash your hands!
Okay, just quickly in the chat, can everyone let me know whether or not they heard that? Yes, faint? Okay, sound is low. We've got a little bit of room left on my audio thing here. Let's not from Hillary. Okay, again, I'm gonna play it through now. My volume is maxed out. You can find this video after we end the meeting.
We can always send out a link if anyone's interested in the link, so
yeah,
that's fine too.
It's because soap, regular soap, fancy honeysuckle soap, honestly, peppermint soap, just any soap, absolutely.
So maybe I'll just like do it aside of the information that's being like told. Basically, there's no special soap. Any soap can eradicate the coronavirus on your hands if used properly. So in this little demonstration, that lotion is supposed to be the coronavirus. So they're showing you how the various hand washing techniques will actually get the virus off of your hands and how long that will take. So after 5 to 10 seconds, your hands still have virus on them. But after 20 seconds, you're looking pretty good. So I don't know if anybody caught that part with the hand sanitizer, but if your hands are sweaty or dirty, it actually cuts down the amount that the sanitizer works. So it's still not as good as washing your hands with any old kind of soap.
Okay. So I think that's a great video. I hope everyone did hear it. Again, we will share the link if you couldn't. It had some important information, but really the takeaway is that washing your hands for 20 seconds will kill the coronavirus. It really is that simple. So
Yes.
let's now look at how, if you do choose, I know Isabel was talking about if you're wearing a mask, you're really protecting other people from you. That is the truth. In addition, if you plan on wearing gloves or are already wearing gloves, there's a very good chance you're not putting them on or taking them off correctly. It's something that non-professionals rarely do. Don't fault yourself for it. It's just that there is a technique to doing this, and this is what it looks like. So if you plan on wearing gloves, this is how you should be putting them on and taking them off.
And they've also said that people who wear masks have a way higher percentage of touching their face. So this is the one thing they're trying to get people not to do. So just be aware if you choose to wear a mask, you're probably going to be touching your face a lot more. So be mindful of where your hands have been.
So here we go. Sorry guys, just give me a sec here. So again, I know it sounds like simple stuff, but I mean, there are really small details about washing your hands, putting it on and taking off gloves that really are going overlooked. And you know, the idea that you can just protect yourself by having the gloves on, it could potentially hurt you, is really what we want to explain here. So I mean, the no-sew face mask, that link is available. Again, I'm going to be sharing the slides that they will end up on our website. I'm going to talk about that in a second here. So if you want to find these links, all you need to do is go through the PowerPoint again and just click on these. You can see a little hand shows up on top of them. Couldn't hear anything. Sorry, Mike. But again, really the visuals there are what was important. But let's move on. So again, I mentioned that Isabel and I, we went and combed through these websites, mostly the WHO, the World Health Organization, to get the information for those quiz questions. They're constantly updating this. As they get information, they're putting it on here. There's a Q&A website you can visit, or a Q&A page rather. I want to highlight this one for everyone, the Mythbusters. If you feel like you've heard something strange, there's a good chance they've addressed it on this page. This is full of very strange things. For example, one of them is that, you know, 5G cell phone towers are spreading the virus. They certainly are not. And the WHO will explain all of this on this page. And then another common one is that, you know, the virus is going to live on certain services for different amounts of time. How long? Lots of different numbers are floating out there. We found a very reliable source on WebMD about different types of services rather, and how long the virus will live on them. So again, you can see it here. As we post this on YouTube, you can either go back to this link and type it in, or just find my slides on our website. But this is where we got all of our information tonight. The last thing I want to give everybody, aside from our contact information, is that we do at BIST have a resources page. I don't know if everybody's found this. I know that you all found how to register for tonight and get to the different webinars, and maybe even our YouTube channel if you dug around a little bit further. But we also have resources. Earlier, Isabel was talking about how we've been helping people get groceries. All of those resources you can find on this page here. So bist.ca/resources-covid-19. There's lots more on there, not just about groceries, not just about COVID information. So please take a look. We're updating it all the time. In addition to that, we also have a warm line open. So our normal BIST info line is operating as it would be normally. You can call and just get information about BIST programs and webinars. But we're also using it as a warm line. Right now is a super difficult time for everybody. Physical distancing, socially isolating, it's been hard for me. I don't get to see my colleagues. We get to Zoom every now and then. But aside from them, you know, I live with one other person, and that's it.
It's very hard for all of us. I think for sure it's hard for me.
Yeah, we like you are struggling with this. So what we've used is the info line as a warm line. And really all that means is that you can call this number from Monday to Friday between 12 o'clock and 4 p.m. So noon to 4 p.m. And you can just have a chat with whoever's on the other line. It might be me, it might be Mary, it might be one of the many students that have been volunteering and helping us out. But if you just need someone to chat with because it's been a hard day, call the number or send an email to info@bist.ca. We'd be happy to help you connect to some of these resources or just chat. Again, our contact information is up there. Isabel is offering her advice if you have questions about CERB. Isabel, I don't know if there's anything else you want to address.
I think I pretty much had my TED Talks about the CERB benefit, and also the, you know, wash your hands, wash your hands, don't wear gloves, wash your hands. That's like really what I wanted to say today. And also I want people to just feel comfortable asking questions, because I have heard some horribly crazy things. Like you guys are getting told some crazy information. We are not living in the movie The Happening. The air is not toxic outside. You can go for a walk around your block, as long as you maintain the physical distance between the people that are walking past you. Please get some fresh air. Honestly, like the sunny days, although they're few and far between right now, are the only thing that are keeping me going at this point, is being able to go outside. So don't feel like you're locked up that too terribly. Like I said before, we're all in this together. Whatever kind of like internal struggle you're having with not seeing people that you normally see, I will speak for myself. I spend most of my time at BIST doing outreach, and I miss seeing my clients face to face. It is hard to go to people's houses to drop off groceries or have them sign forms and not be able to sit and have a chat with them about how their lives are going. So if you think that we have forgotten you or that we don't think about you, we absolutely do. We're just all in the same boat at this point. So any kind of resource or help that we can offer you, I think at this point, please just ask for it. And if there's a way we can find somebody who does it, or if we do it, well, let's figure it out. Like whatever we have to do, let's figure it out together, so you can still maintain the same level of support you had before, and you don't feel like you're lacking too much, and you don't feel like you're missing humanity too much, because I think we all are right now. So
yeah, absolutely.
That's it.
So, I mean, that pretty well concludes our presentation. I do want to give you guys as much time as you want to either ask us some questions, give us some comments. So the chat and Q&A are open. No problem, Mike. Thank you for coming. I really hope that you took something out of tonight. Again, that resources page, we will be uploading the slides to, as well as the presentation, the whole recording, even this right now, on our YouTube channel. You'll find all of our webinars on there. But please ask any questions right now. Feel free.
I mean, I think we all look forward to the day when we can all be in the same room together again. So I think that's the ultimate goal. So if we keep doing what we're doing, fingers crossed that happens sooner than later.
Yeah.
I hope.
You want to ask about how to get library cards. Okay, there's a few coming in. Okay, continue to post. I'm just going to scroll back here. So Hillary, you've asked about how to get library cards. I'm assuming that means you don't have one right now. I have tried to call the library to get some more information. Because they're closed out, I'm not sure if they're just short-staffed or what the deal is. I don't have an answer yet, but I have sent some emails. I am looking into how anyone who doesn't have a library card right now might go about getting one. As soon as I find out, I will connect with Mary, our communications coordinator, and I will find a way to either update these slides with that answer, or maybe we'll post it on social media. However I can get the answer to you, Hillary. Maybe I'll email you directly, actually. I will get you the answer one way or another. But that's a great question. What else do we have here? So
What
basically,
are your
wash your hands.
recommendations for managing post-concussive symptoms? I'm assuming that is what PCS was in that question.
Could be, yeah.
I'm guessing. I guess the question is, what symptoms specifically are you having trouble with? Is it just like you're feeling lonely or feeling isolated, and so tech is the only kind of outreach or connection that you have? What specifically about the symptoms are you? Yes, that is a good question. Not everybody can watch a screen. That is absolutely correct. And so I think that that's why Ryan and I kind of wanted to have like audio stuff. Yeah, like the podcast and that kind of stuff. But yeah, it is tricky. Like I said, the weather hasn't been great enough to go outside every day either. It's one of those weird, challenging times where we kind of have to fly by the seat of our pants and hope that we make the right decision when it comes to activities that we're doing. If there's any way you could connect to people, maybe in a Zoom, and not enter with video, you could just enter with audio and talk to other people. One thing that I've had happen lately is I'm a super texter. I actually hate talking to people on the phone, but my friends have been asking to call me and we've been having phone conversations and it's actually been quite lovely. So honestly, just hearing another human being's voice on the phone, talking about something that is not COVID related and not talking to my 2-year-old has been fantastic. So if you have any peer, I mean, the warm line is a great way to talk to somebody who's another human and just chat about things. And so if you feel lonely and you feel isolated, but you're able to, you know, listen and that's all right, then call the warm line, call some peers if you are able to do that. I'm sure that Toronto also has a lot of 24-hour crisis lines that are probably also operating as warm lines for people right now who are isolated. I'm sure there's plenty of ways you could connect with other people that don't require looking at a screen.
Absolutely. And thank you, Shireen. I see that you've offered another resource that people can take advantage of, a Broadway show. And you provided the YouTube link. Thank you. The Toronto Public Library is offering digital cards good until September.
Awesome.
That's awesome. I hope it's as easy as just sending them an email or giving them a phone call. But Hillary, I hope that answers your question.
Looks like there's a link up there for the digital card, so that's really awesome. So if anybody wants to copy and paste that into their browser, it seems that you can access it that way. So that's fantastic. iHeartRadio, I've heard, is really good. So
awesome. Thank you again, Shireen, for posting that. It's great.
I also heard, and I don't know if this is true, but I think it is, that every Friday night, if you're into musicals, Andrew Lloyd Webber is broadcasting another musical. So if you like any of his work, you can, I think, watch it. I don't know where you can watch it. I'm not sure exactly where you can watch it, but there's an Andrew Lloyd Webber broadcast.
Yeah, it's on YouTube. I'm not sure how much longer he's doing it. I think he's done about 5 or 6 now.
I think so,
and
too.
It's something like once a week for 2 nights. He'll be broadcasting them.
Oh, there we go. Thank you, Shireen, for the link to his musicals. You're rocking
on the ball. Thank you, Shireen. Yeah. So if you're into musicals, I know if you've met all of the BIST staff, there are a couple who are, but some good ones.
The other thing, I'm not sure if any of you, I mean, I'm sure everybody has Facebook at this point. A lot of my friends are musicians full-time, and a lot of the local musicians have been broadcasting like pub nights or live shows on Facebook, where you can enter their Facebook lives and you can talk to other people who are also watching the music. It's like a live show, kind of being at a pub, but you're in your home, and you still get to enjoy their talent and their art, but safely. But it is a great way to connect because there's a comment section on the bottom where you can chat with the other people who were there, and you can give feedback to the musician, and you know, it gives them something to do and gives us something to do. I've watched a few of my friends do them, and honestly, like, made my whole day, so it can be pretty helpful.
Awesome. Again, we have about 5 more minutes. Please send in your questions. I did also want to let everyone know that, you know, if you've been sending us comments, emails, suggestions about different webinars, we have been taking them very seriously. You will see, I believe Mary may have already put it up, but our May calendar is going to be full of webinars. We've got, I think, something new each week. So please check our website. Please register, come check out whatever makes sense for you. We're going to have everything from information on diet and nutrition and exercise, to mindfulness, to ways to stay creative. And I know there's another, it's just escaping me right now, but we do have a lot more coming your way, and please continue to suggest the things you want to hear about. We will find someone who wants to share or donate their time.
So I don't know if I'm allowed to do this, but I'm going to do it anyways because I never do things I'm allowed anyhow. Starting May 14th, I believe from 1 to 3, we're going to be offering an adult WRAP program, which stands for Wellness Recovery Action Planning. We're going to be limiting the class to 12 people. There's going to be some registration links posted by Mary as soon as I create them. So if that is something you're interested in, it will be on Zoom virtually. It will be a great opportunity to create a wellness plan and also connect with other people. and sort of talk about the struggles you're going through right now. So if that's something you're interested in, the links will be out hopefully this week or next, because it's just depends on how quickly I can get them out. But
Yeah.
that will be available.
And I'm going to just shift over. Victoria, thank you for your comment. With regard to a mask, I understand you want a surgical mask, but they're very hard to come by. In an earlier slide, I'm going to skip back over to it. There is a way to make a no-sew face mask. It's absolutely not surgical grade, but this video was made by the CDC, that's the Center for Disease Control in the United States. So, I mean, just something you can use. I understand and share your frustrations. Having masks, well, one way or another, does provide some level of comfort. So when we do upload these, please check out this video. You will find it helpful. Okay, so we're coming up to 8 o'clock again. Please send any of your last questions. We'll be wrapping up soon. Thank you everyone for attending.
Yes,
I know this is a bit of a different thing we're doing for the community meeting, but you know, I think it's a timely one. I know we've been, what, isolated for a little over 6 weeks or so now, more.
Crazy.
We're running out of stuff to do. So.
But at the same time, I think we want to make sure that everybody has information that makes them feel safe, like that makes them feel like they're making the right decisions for themselves and when they go out and venture into the community, and that they can stay safe during all of this. So we have a question in the Q&A that says, would using a nail brush assist in washing one's hands better?
I don't know what a nail brush is. I'm sorry.
It's like one of those brushes that you use to scrub your nails when you're, so here's my thing, and this is totally my personal opinion. It's not medical or anything, but if you use a brush of any kind to wash your hands, bacteria can get caught on that thing. So that surface. So as Ryan mentioned earlier, there's a website from WebMD that explains how long the coronavirus lives on certain surfaces. So my concern with the brush would be that if you did come into contact with it and then you used it to wash your hands, regardless of the amount of soap or whatnot that you use, some piece of it could maybe get caught on there. And then you'd be re-exposing yourself and anybody else that came into contact with the nail brush. The best really way to prevent it or to kill it is to just practice proper hand washing. And anybody who's been in a first aid class or any kind of CPR class has been taught how to do that. So, I mean, nurses and doctors do that. They scrub up before they do surgeries on people. So that is really the best way to keep your hands clean, is just wash them. Don't touch any surfaces that could have coronavirus living on it and then put it back on your hands. Don't like try the whole re-exposure thing. Don't put yourself at risk for that. Just wash your hands. Just wash your hands.
Yeah, good advice.
Just wash your hands properly with soap. That's all, for 20 seconds or more.
Okay, everyone. Thank you again. I hope to see you all again soon in the groups and on our other webinars. Thank you again for attending, and have a good night.
Thank you. See you guys later.